Our healthcare system in America isn't working. You've heard that from me before, but I have to keep shouting it because every day I see the consequences of this broken system. I honestly believe that what's going on in our healthcare system now is medical negligence. And although I have no way to prove it, I honestly believe that our healthcare system is directly responsible for way more deaths than it was a decade ago. And I don't mean medical mistakes or medical incompetence. I mean not giving patients the information they need to make an informed decision about their own care. This negligence of not giving patients information results in the patients not being able to decide that they want to go after a certain intervention to treat a disease, or even to make a decision not to treat the disease, but to plan for how it might work out as time goes on. For example, making a plan to hire help or having family around or having to go into a facility. But not giving patients the information doesn't allow them to be able to make any decisions. And in not giving patients this information, it's delaying treatment if someone decides they want treatment. And for some diseases, that delay in treatment can lead to death. As a PT working in short-term and long-term care, I have access to medical records, to testing that's been done, to scans that have been done. And I see case after case of patients going to the hospital, having some scanning or some testing being done, and it's showing some concerning results. But then while the person is at the hospital, these results are not given to them or their families. I'm not exactly sure why this information isn't being given. I can guess that, like everywhere, doctors are given more work than they can ever fit in a day. But somewhere along the line, somebody has to tell the patient this information. And often the person's primary care doctor doesn't have this information either. So although they usually have access to the system that holds the information, if they're not alerted to it, or they're not aware their patient had this testing being done, they're not going to see it unless they're alerted to it. And then they come into a facility for short-term rehab. The practitioners at a facility like that are also usually focused on the reason the patient came to the facility. Although they look at the bigger picture some, there's still a lot of the patient's medical history that is not really addressed in a short-term rehab facility. And from my perspective, they're not the ones that will tell a test result unless it's related to the reason that they're in the facility. So then the patient's not getting the information from the hospital. They're not getting the information from our facility. As a PT, I'm often told to stay in my lane, which basically means pay attention to why the patient is there and only pay attention to that. That's never sat well with me. As a PT, one of our standards of practice is that we empower patients and their families to advocate for their own health. How can they do this if they don't have the information they need to make informed decisions? I feel like this is becoming a normalization of a new way of healthcare, and I think it's dangerous. We're getting used to waiting for months to see a doctor, waiting for months for follow-ups, hearing the excuse of understaffing everywhere. If we just keep blindly accepting that this is the way it is, it's not going to change. Do you remember when smoking was a normal thing? I'm kind of dating myself, but do you remember when everybody smoked? Everywhere you went, everybody was smoking. It was normalized. And the normalization of it delayed us understanding how dangerous it was, and it delayed any regulatory action to help to protect us. It's similar in the healthcare system. If we normalize this, there's not going to be any push to change it. I want to recognize and challenge the normalcy of the way healthcare is going. And as patients and family members, we can take a proactive approach. That begins by getting any documentation related to a hospital stay or a short-term rehab stay. Go over that documentation. Highlight the things that don't make sense or you don't understand, and then bring that to the primary care physician and have them explain it. That's a first step in making sure that we're getting the information we need when people aren't just going to give it to us. I had a patient recently that reminded me of this again. She came into our facility for, I think, a breathing issue. She has a history of breast cancer, gets treatments, takes a pill every day, and sees her oncologist every 6 months. They're trying to limit the cancer from spreading. She had to go back out to the hospital for an intestinal issue, had some scanning done, had some general scanning done also that showed concern for a a growth in her brain, specifically in her frontal lobe. She came back to our facility. The hospital didn't give her that, or the family, that information. Our facility hasn't given her that information. And it's eating me up because I know that she only sees her oncologist every 6 months. So the lapse in time before the oncologist knows what's going on could be a significant amount of time, where she could be getting treatment or she could be making plans for her future. And I'm not going to tell her this information, but I am going to empower her to advocate for her own health care. And in doing that, I'm going to recommend to her that she tell her oncologist that she had some scanning done recently while she was hospitalized, and ask him if he would please look at that scan and let her know what he thinks. In that way, she'll be able to get the information she needs to make the best decisions for her. Our American healthcare system isn't going to fix itself. The motivation to change has to come from us, from the people who experience how broken it is. It's up to us to sound the alarm, spotlight the issues, and demand change. And to start, we can shift from passively accepting care to advocating for the best care. We have to confront and refuse to accept this new normal of healthcare. We need healthcare that meets the standard of care, but it has to promote communication and patient empowerment. Thanks for watching today's video. Please like and subscribe. Let me know what you think in the comment section below.